Many older adults often regard nuts as a healthy snack that provides extra nutrients and supports cardiovascular and brain health. Yet research shows that consuming the wrong kinds of common nuts can increase the risk of heart disease, cause chronic inflammation, clog arteries, and negatively affect liver, kidney, and cognitive function, especially in seniors whose detoxification mechanisms are less efficient. Understanding which nuts truly benefit bone, heart, and brain health in those over 60, which nuts must be avoided, and the hidden dangers of the most hazardous nut are crucial for long-term well-being. Almonds stand out as one of the most nutrient-dense choices, particularly suitable for seniors. Although their calcium content does not match that of dairy, a modest serving of about 15 to 20 almonds, roughly 30 grams, delivers nearly 100 milligrams of calcium, helping to slow bone loss after age 65. At the same time, the magnesium in almonds, around 75 milligrams per 30 grams, assists in transporting and regulating calcium, preventing unwanted deposits in blood vessels and ensuring calcium reaches the bones. This interplay reduces the risk of osteoporosis and fractures, especially as the body's ability to absorb and metabolize vitamin D and calcium declines with age. Heart health also benefits. The monounsaturated fats in almonds help lower LDL cholesterol while maintaining HDL levels, a critical factor as cardiovascular risk rises over time. Additionally, vitamin E, about 7 milligrams per 30 grams, acts as an antioxidant, protecting vascular endothelium from free radical damage and reducing inflammation. The fiber content, around 3.5 grams per 30 grams, supports digestion and prevents constipation, a common concern among seniors, while also helping to stabilize blood sugar and dampen insulin spikes. Flavonoids in the almond skin work alongside vitamin E to boost neuroprotective antioxidant capacity, guarding brain cells against oxidative stress and potentially slowing cognitive decline. To maximize benefits, almonds should be chewed thoroughly. Soaking or grinding them into softer forms can help those with swallowing difficulties, and stored in the refrigerator to prevent rancidity. Avoid salted or flavored varieties to keep sodium intake in check. A daily intake of 15 to 20 almonds, split into portions alongside meals or as snacks, helps control hunger and maintain stable blood glucose levels. However, portion size must be adjusted for those managing caloric intake, as about 30 grams of almonds contains 160 to 170 kcal. When consumed wisely, almonds offer essential support for bone, heart, and brain health in older adults. Walnuts, recognizable by their brain-like shape, are prized for their high plant-based omega-3 content, alpha-linolenic acid, ALA, the highest among common nuts. For seniors, omega-3 fatty acids are vital in maintaining healthy brain cell membranes, facilitating efficient neural signaling, and reducing inflammation. Studies indicate that eating approximately 1.5 ounces, around 42 grams, or 7 to 9 walnut halves daily for 8 weeks can improve processing speed and mental flexibility in older individuals. Unique walnut polyphenols can cross the blood-brain barrier, helping to prevent or slow the progression of neurodegenerative conditions such as Alzheimer's and dementia through anti-inflammatory and antioxidant actions. Walnuts also naturally contain melatonin, which can aid sleep quality, an important benefit for many seniors facing insomnia or fragmented rest. A small handful of walnuts before bedtime may promote relaxation and better sleep. Beyond cognitive benefits, walnuts support cardiovascular health. ALA partly converts to EPA-DHA, reducing vascular inflammation, lowering triglycerides, and improving lipid profiles. Additional antioxidants protect the endothelium from oxidative stress, lowering atherosclerosis risk. Walnut components like arginine and polyphenols further aid vascular function, helping blood vessels remain flexible and complementing blood pressure management. Since walnuts contain delicate oils prone to rancidity, they should be stored in the refrigerator and used promptly. Salted or flavored versions should be avoided. Seniors should chew walnuts thoroughly or crack them manually to exercise fine motor skills and reduce choking risk. For those with swallowing difficulties, chopping or grinding and sprinkling over yogurt, oatmeal, or porridge is a practical alternative. Although walnut calories, around 185 kilocalories per 30 grams, require portion awareness, regular, moderate consumption delivers significant cognitive, sleep, cardiovascular, and fine motor benefits, making walnuts a super nut for older adults. Pistachios, often underrated compared to almonds and walnuts, offer particular advantages for blood pressure regulation and eye protection in seniors. Naturally low in sodium and high in potassium, around 285 milligrams per 30 grams, pistachios help maintain electrolyte balance and support the kidneys in excreting excess salt, which can contribute to lowering blood pressure. Research shows that eating about 1 ounce, roughly 49 pistachios, daily may reduce systolic blood pressure by 3 to 5 mmHg, comparable to some medications but without side effects. Moreover, pistachios are rich in lutein and zeaxanthin, carotenoids concentrated in the macula, that combat age-related macular degeneration, a leading cause of vision loss in those over 60. Antioxidants in the green-purple skins further neutralize free radicals, reduce systemic inflammation, and support healthy aging. The act of shelling pistachios encourages slower, mindful eating and portion control, helping prevent overeating while also engaging hand-eye coordination and fine motor skills, beneficial activities for seniors. For those with arthritic hands, partially shelled pistachios make handling easier, or pre-shelled nuts can be used with careful portion monitoring. With about 3 grams of fiber per 30 grams, pistachios help stabilize blood sugar, valuable for seniors at risk of diabetes or prediabetes, and support digestion to prevent constipation. Their plant protein content also aids in maintaining muscle mass, important for counteracting age-related sarcopenia. To use pistachios wisely, choose unsalted or lightly salted varieties, store them cool to prevent rancidity, and limit intake to around 49 nuts, 30 grams, daily, as a morning or afternoon snack, perhaps paired with fresh fruit or plain yogurt. Although calories must be balanced within total daily intake, pistachios' combined benefits for blood pressure, eye health, digestion, and blood sugar regulation make them an excellent choice for older adults. Brazil nuts are renowned for their exceptionally high selenium content, around 96 microgram per nut, making them a potent natural source of this essential trace mineral. Selenium supports thyroid function by enabling the enzyme that converts T4 into the active T3 hormone. Since thyroid decline in seniors often masquerades as normal aging, manifesting as fatigue, weight gain, or mood changes, a small daily dose of selenium from Brazil nuts helps maintain thyroid activity, supporting energy metabolism, reducing fatigue, and improving mood. Selenium also exerts antioxidant protection for nerve cells, helping preserve the myelin sheath around nerve fibers, which can degrade with age. This preservation may help seniors maintain reflexes, reaction times, and cognitive processing speed. The selenium in Brazil nuts is organically bound and highly bioavailable compared to synthetic supplements. Additionally, they contain healthy fats, fiber, and protein. Fiber aids digestion and prevents constipation, while their rich, buttery taste offers a nutritious snack alternative. Emerging research suggests antioxidants in Brazil nuts may slow telomere shortening, caps on chromosomes that shorten with age, potentially influencing cellular aging, though further studies are needed. However, because excess selenium can be toxic, leading to fatigue, hair loss, digestive upset, and potential neurological harm, intake must be limited to 1 to 2 nuts per day and stored in the refrigerator to avoid rancidity. Individuals with kidney issues or other conditions should consult a physician before use. For seniors, Brazil nuts offer a small-dose, high-impact source of selenium for thyroid and nervous system health, but strict adherence to the small serving is essential. They can be integrated weekly, alongside almonds and walnuts, to diversify nutrients without risking overdose. For example, enjoying 1 Brazil nut as a morning snack or sprinkled in small pieces over yogurt or salad ensures safe, effective benefits. By contrast, certain nuts pose hidden hazards or should be eaten extremely sparingly by older adults. Peanuts, often seen as an inexpensive everyday snack, carry several risks. As legumes, peanuts are prone to mold contamination, Aspergillus, producing aflatoxin, a potent liver toxin associated with higher cancer risk, which seniors are more vulnerable to due to declining liver and kidney detoxification. Peanut proteins can trigger low-grade inflammation, exacerbating joint pain, cardiovascular strain, and cognitive decline. Their high omega-6 to omega-3 ratio promotes chronic inflammation in blood vessels, joints, and brain, elevating risks for heart disease, osteoarthritis, and neurodegenerative conditions. Peanuts also contain vitamin K, which may interact with anticoagulant medications like warfarin, complicating dosage control and posing serious dangers. Risks often undercommunicated to older patients. Furthermore, commercial peanut butter often includes hydrogenated oils, trans fats, salt, and sugar, raising LDL cholesterol and blood pressure, burdening the cardiovascular system. Even natural peanuts can go rancid easily, producing free radicals if stored poorly, and industrial roasting may generate acrylamide, potentially impairing cognition or increasing cancer risk. For these reasons, seniors should limit or avoid peanuts. Occasional consumption of organic, lightly roasted, unsalted peanuts, kept in small portions and stored carefully, is far less hazardous, but safer nuts like almonds, walnuts, pistachios, or Brazil nuts are preferable. Those with cardiovascular issues, arthritis, or on anticoagulants should avoid peanuts altogether. Cashews, prized for their sweet, creamy flavor and soft texture, also present concerns for older adults. With a relatively high carbohydrate content, 9 grams per ounce, and moderate to high glycemic index, but lacking protective fiber, cashews can cause blood sugar fluctuations, especially problematic given high rates of diabetes and prediabetes among seniors. Cashews contain oxalates that bind calcium in the gut, reducing absorption and increasing osteoporosis risk, while also elevating kidney stone risk common in older age. The complex processing required to remove toxic resin can strip nutrients or leave residues, and many commercial cashews are oil roasted and salted, adding unhealthy fats and sodium that burden heart health and blood pressure. Cashews also contain enzyme inhibitors that hinder protein digestion, problematic for seniors with reduced digestive efficiency, and their creamy texture encourages overeating, contributing to weight gain when metabolism slows. They may pose a choking hazard for those with swallowing difficulties and are among the nuts most likely to be aspirated by seniors. To minimize risk, cashews should be replaced with higher fiber, omega-3 rich nuts like walnuts or almonds. If consumed at all, it should be sparingly, perhaps 5-7 nuts occasionally, not daily, choosing raw or dry roasted unsalted versions stored in the refrigerator. Cashews should not serve as an everyday snack, particularly for those with diabetes, kidney issues, or osteoporosis. A balanced diet rich in vegetables, lean proteins, and controlled carbohydrates remains paramount. Macadamia nuts, though prized for their rich, buttery flavor, rank highest in calorie density, about 200 kcal per ounce, and contain substantial total fat, 22 grams per ounce, including 3 grams saturated fat. For older adults whose metabolic rate declines, macadamias can easily lead to weight gain, increasing stress on joints and cardiovascular risk. Their saturated fat content may raise LDL cholesterol, while the high fat load can trigger gallbladder discomfort in seniors with silent gallstones, since digesting large fat quantities requires strong gallbladder contractions. Their firm, crunchy texture also risks damaging dental enamel or restorations in those with weakened teeth. Macadamias are often expensive, leading some seniors to buy lower quality or improperly stored nuts, prone to rancidity and harmful oxidized lipids. Oil-roasted or salted varieties exacerbate these issues. Although general nut benefits for heart health are often cited, research tends to overlook macadamias due to their high saturated fat. If consumed at all by seniors, macadamias should be limited to an occasional small treat, with preference given to healthier nuts like almonds, walnuts, or pistachios. Raw or dry roasted unsalted versions stored cold are the least harmful, but avoidance or strict moderation is advised, particularly for those with dental concerns or weight management goals. Pine nuts, frequently used in pesto or salads, carry multiple hidden risks for older adults. They contain compounds that can interact with many medications common among seniors: statins, antidepressants, blood pressure drugs, potentially reducing efficacy or increasing side effects, yet this risk is seldom highlighted. Some individuals develop pine nut taste disturbance, a bitter or metallic aftertaste lasting weeks after consumption. In seniors, this can reduce appetite, leading to weight loss and malnutrition, aggravating already fragile nutritional status. Pine nuts are rich in polyunsaturated fats that oxidize quickly, producing inflammatory compounds undesirable for those with chronic inflammatory conditions like arthritis. Their small size and slippery texture increase choking risk for those with swallowing difficulties or dry mouth due to multiple medications. Enzyme inhibitors in pine nuts can impede protein absorption, further burdening older digestive systems. Being calorie-dense, pine nuts can also contribute to weight management challenges in seniors. Emerging research suggests some chemicals in pine nut varieties may accelerate age-related macular degeneration, raising vision loss risk. Given these combined hazards, medication interactions, prolonged bitter taste syndrome, increased inflammation, choking risk, weight gain, and potential vision impact, pine nuts are unsuitable for individuals over 65. Safer alternatives for pesto or salads include shaved almonds, roasted pumpkin seeds, or pistachios. If pine nuts are tried occasionally, only tiny amounts should be used with careful monitoring, and those on multiple medications should avoid them entirely. Overall, daily dietary choices, including nut selection, profoundly influence cardiovascular, bone joint, and brain health in older adults. Before making any nut a regular part of the diet, individuals should assess their health status: diabetes, heart disease, kidney function, dental health, medications, and consult healthcare providers as needed. Proper storage, refrigeration, keeping shells intact, prevents rancidity and preserves nutrients. Starting with small portions, chewing carefully, eating mindfully, and observing any unusual reactions helps ensure safety. Incorporating a variety of beneficial nuts, such as almonds, walnuts, pistachios, and a small Brazil nut, while gradually reducing or eliminating higher-risk nuts, yields balanced nutrition. Combining nut consumption with light exercise, weight management, adequate hydration, good sleep, and a positive mindset enhances overall well-being. By being cautious of risky nuts and prioritizing those with proven benefits, seniors over 60 can reduce chronic inflammation, support heart, bone, and cognitive function, and maintain independence and quality of life. Consistent small habits produce significant long-term results. Starting today and sharing experiences can strengthen the health of the senior community.